I had a special patient, a 8-year-old boy in the rural country of China. He had a very bad type of leukemia. He didn't really like to talk much in the hospital, but he loved the stories. So I tried to find some interesting stories and to tell him. So after several months of a treatment, his medicine actually stopped working. And one morning, actually I was very excited because I found a very funny story. I can't really wait to tell him. So I walked into his room, but nobody was there. They snuck out of the hospital in the middle of the night. At that moment, my heart was dropped. But I can't help them. And I wished there were more effective medicines for him, but they were not. So I quit my dream to become a scientist and work in the lab. I hope one day, through my research, or maybe many other people's research, we can really prevent all these beautiful kids, like this little boy, never get into the hospital, and the cancers won't take anyone's life anymore.
It's really nice that there's a foundation that gives support to new investigators like me who are really just getting started with these types of projects, and we were able to take something that's really more of an interesting observation or a really cool idea and develop it into the point where we can really understand what's happening.
When we talk to people about what we have done, about the research, sometimes it's probably so difficult for them to understand.
Some details are really key because they can help people make connections on a really personal level.
As a scientist, we're trained to tell a story in a certain way. That makes sense to scientists who've had years of training in multiple degrees, but may not be so accessible for our patients and for people who are not in our line of work.
What I like most is the story of making them human, because to the scientific world is about other people. Rarely do people say, oh, I'm doing this because of me.
Hearing stories today from other V scholars about what motivates them to do their research, how much they remember individual patients and how much individual patients really have an impact on their career choices and what they've done to move forward. So that was a big benefit for me today about hearing other people's stories.